Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates.
Graft rejections. So the first one being the hyperacute. So hyperacute rejection. So what is meant by the hyperacute rejection? It occurs within minutes to hours after the transplantation. So minutes to hours after the transplantation. So there is an immediate graft destruction, and this is due to the ABO or the preformed HLA antibodies. Next is it is characterized by the intravascular thrombosis, and the kidney transplants are vulnerable to the hyperacute rejection. So where is the hyperacute rejection seen? It can be seen in case of the kidney. And while the heart and the liver transplants, they are relatively resistant. So heart and liver, what happens to this? It becomes resistant. Next we move on to the acute. The acute is also known as a cellular. So the acute rejection. So acute or the cellular rejection, it occurs in the first 6 months post transplantation. So first 6 months post transplantation. So what is exactly happening here? So most commonly it presents with the 5 to 30 days after transplantation. So 5 to 30 days after the transplantation it occurs, and the T cell dependent processes, it is a totally T cell dependent process, and it is characterized by the mononuclear cell infiltration. So mononuclear cell infiltration is something which is seen. So this is acute rejection, it becomes reversible as well. Next we move on to something known as a chronic rejection. The chronic rejection, it occurs in the first 6 months post transplant. So it is very similar. So it is occurs after the first, whereas the acute it is in the first. So it is after the 6 months, and it is most common cause of the graft failure. So it can lead to the graft failure. It is a non-immune factor, contributes to the pathogenesis. So it's non-immune factors. Then it is characterized by a myointimal proliferation in the great arteries. So myointimal proliferation in the graft arteries, and this leads to there is a ischemia and also the fibrosis. Then moving on, we look at the treatment. The treatment of the graft rejections, we can administer corticosteroids as well as the immunosuppressive drugs. So how do you prevent this condition? So prevention, if you see, it is by the histocompatibility testing, and also there is a recipient preparation. And there is a post-operative immunosuppressive therapy, PIT.
To learn and grow daily like this, please do subscribe.